Hello, I am Ronald van Vollenhoven, Editor-in-Chief of Lupus Science and Medicine, and I am reporting live from the Euler Congress 2020, the first Congress which is held completely as a web-based digital Congress. So when I'm saying I'm reporting live, I am reporting from my office. And it's a really strange experience, but very interesting. And it is possible to get to hear and see a lot of very, very good science. It's the first day, and we just had a great session on the situation with COVID. COVID, the pandemic that has held us in its grip, and that's actually the reason that the Euler Congress is not taking place as it was planned in the Congress Center of Frankfurt, Germany. And this session was chaired by Professor Hans Bijlsma, the former president of Euler, and there were four excellent presentations. Uh, Dr. Robert Landue from my center, the Amsterdam University Medical Center, actually presented the provisional recommendations by Euler for how to manage patients with COVID-19 infection if they also have rheumatological diseases and treatments. And it was commented on by Dr. Ted Mickles from the United States because there are some differences between the published recommendations from Euler and ACR. And then there was also a more theoretical presentation from Dr. Kroon from the Netherlands about how the new disease and the new evidence evolves. And finally, some data on mavrilimumab, the anti-GM-CSF monoclonal antibody, with some suggestion of efficacy in patients with a very severe COVID-19 pneumonia. And all this being presented here at the EULAR also reminded me of how there are lots of publications now coming out about COVID-19 and its implications for patients with many diseases, including lupus. And of course, in Lupus Science and Medicine, we had two very interesting letters, communications about COVID-19 in patients with lupus, one by Horsberger et al., and also one by Drs. Eskenazi and others in New York, where the infection, of course, has hit very hard. And these viewpoints from clinicians who are in the midst of the epidemic, who are seeing the patients, who are taking care of the patients, and sometimes saving the lives of the patients, and sometimes, unfortunately, losing some. These are very, very valuable. And I'm glad that this topic is receiving due attention, as we're also hoping for this large pandemic to subside. And here at the Euler Congress, we will learn about that a lot more, I think, in the coming days. There are many presentations, but of course, there's also lots of other stuff. And I hope to be reporting to you in the next few days with more on the Euler Congress. Thank you very much.